Joe, if you would call the first speaker.
Mr. Chairman, the first speaker is Molly Vick, and on deck is Liz Remick.
Hi, my name's Molly Vick. I'm a citizen, a professional, a mom, and now a year into my moonlighting as an activist. I've spoken to you many times over the past year, and I currently have the legal request in front of the VDH, in front of you, to amend the regulations for licensure of hospitals. Though termed a petition, it is a legal request formally made to the registrar as stated and must be responded to under set code requirements. There has been the formal public comment period on this petition. They received hundreds of comments and closed May 26th. Per code, the agency has 90 days from close to issue a written decision to grant or deny my request. There's additional in the code, quote, however, if the rulemaking authority is vested in an entity that is not met within the 90-day period, the entity shall issue a written decision no later than 14 days after it next meets. I understand the spirit of this to be that you, the entity with the rulemaking authority, is intended to meet on this subject prior to the decision. The fact that the meeting fell so quickly following the end of the comment period that I was informed was not time to synthesize the many comments and include it on the agenda should not keep the board from meeting on this subject, whether it is added to the agenda live here today or there's a special meeting scheduled in the very near future. In your bylaws, under Article 2 meetings, Section 4, special meetings, it states, the chair or any 3 members of the board may call a special meeting for specific purpose or purposes for the content of that specific agenda item. There's nothing about emergent needs or anything else, merely that the meeting has a specific purpose. Once decided, the written decision must be issued by the agency, included a statement of its reasons, and submitted to the registrar for publication. The petition before you is to amend the regulations for the licensure of hospitals in Virginia because you, the board, did not have the authority to have adopted them due to a conflict in codes. However, hospital regulations apply the 2010 guidelines for design and construction only to new construction or alterations of existing facilities.
Thank you. Next speaker is Liz Remick, and on deck is Colin Swegman.
The petition before you to amend the regulations for the licensure of hospitals in Virginia because you, the board, did not have the authority to adopt them due to a conflict in codes. Current hospital regulations apply the 2010 guidelines for design and construction only to new construction or alterations in existing facilities. However, the Attorney General's office clearly stated that such regulations differentiating between new and existing facilities are not allowed, as communicated to Dr. Remley last July regarding women's health centers, now categorized as hospitals. This conflict is what my petition addresses. As further evidence, the meeting minutes from the June 15, 2012 Board of Health meetings include statements from the AG's office on the VA code that relates to the crafting of regulations consistent with the guidelines. Ms. Tissinger, Senior Assistant Attorney General, stated that Code 32.1-127.001 is not limited to new construction. She also advised the board that the hospital licensure regulations will have to be amended because of the inconsistencies with that code. As an aside, because it seems to cause a lot of confusion, the code Ms. Tissinger referenced that they said the grandfathering was inconsistent with was not SB 924, the 2011 legislation that defined or named abortion facilities as hospitals. That code was not mentioned in the failure to certify or the legal argument given at all. The code she was referring to is from 2005. The original legislation that the hospital regulations must be consistent with the current facility guidelines. Guidelines that Ms. Tissinger acknowledges state themselves that they are only applicable to new construction. Consistent with means fidelity to what the guidelines themselves state, except apparently only for women's health centers, where the Attorney General's interpretation is different. The Attorney General's office has now weighed in publicly on the petition. Just this week, they were quoted by Richmond Magazine that they are aware of the petition.
Thank you. Next speaker is Colin Swegman, and on deck is Jordan Romeo.
Hi. Just this week, they were quoted by Richmond Magazine that they are aware of the petition, and per AG Cuccinelli's spokesman, they have already advised the Board of Health that provisions governing hospitals need to be made consistent with those governing abortion clinics. This is what the petition is all about: consistency. Equitable application of the law. The Attorney General's office was so intent to get these regulations passed in a manner that would result in limiting access, without grandfathering in existing clinics, even altering precedent of the application of building requirements, that they were willing to make it up as they went along. But then they were caught in the inconsistencies. Yet they were still willing to change everything previous, unintended consequences and ramifications to real health issues be damned, in order to make these regulations that Ken Cuccinelli has personally been championing by any means possible or necessary for over a decade, to make them just the way they needed to obtain the desired result. And it worked. The first clinic closing has occurred. There will be more, but there is this problem. When you're willing to say anything, interpret as you go along, sometimes you get caught in bad arguments. First, it was that the code was not limited to new facilities. Despite Ms. Teisinger's acknowledgement to Ms. Jang, you are correct that the guidelines do state themselves that they are applicable to new construction. She tries to use a lack of specificity in the code to change the meaning from how it had been interpreted in every regulation promulgated or amended by you since the 2005 legislation passing. Quote, "The General Assembly did not limit the applicability of those guidelines to simply new construction," which is absurd. It reads, "Certain design and construction standards to be incorporated in hospital and nursing home licensure regulations. Notwithstanding any law or regulation to the contrary, the Board of Health shall promulgate regulations pursuant to Code 32.1-127.
Thank you. Next speaker is Jordan Romeo, and on deck is Liz Musselman.
Hold on a second. Kathy, can you restart the clock?
Thank you. The code reads, certain design and construction standards to be incorporated in hospital and nursing home licensure regulations. Notwithstanding any law or regulation to the contrary, the Board of Health shall promulgate regulations pursuant to Code 32.1-127 for the licensure of hospitals and nursing homes that shall include minimum standards for the design and construction of hospitals, nursing homes, and certified nursing facilities consistent with the current edition of the Guidelines for Design and Construction of Hospital and Healthcare Facilities issued by the American Institute of Architects Academy of Architecture for Health. As Mr. Edmondson says in response, take a look at the law. If the plain language of the statute doesn't make it clear, then you must rely upon the obviousness of the language. But really, they said it applies to new and existing. Then there was a consistency issue. Well, must retroactively update all other previous regulations now. Sure, we'll just arbitrarily make this decision. Whoops, wait, unintended consequences. To be consistent would be to consistently limit access, consistently close down existing structures through cost prohibitive, unnecessary structural changes. But now these structures are full-service general hospitals. I know. It depends what your definition of new is. If you weren't licensed previously because we hadn't defined you as necessitating license, you must be new. It is a ridiculous argument to start with, but it was all they had left. You don't exist until I name you. But there's another problem. This isn't how it works. It isn't how it has ever worked. General hospitals were existing facilities before the General Assembly defined them as such in 1947. That is when it happened, not unlike the defining of abortion clinics as hospitals in 2011. Yet the original 1948 regulations differentiated between new and existing. While we haven't had time to look into every possibility, let's think about it.
Thank you. Next speaker is Liz Musselman, and on deck is Kate Bartelsnoon.
While we haven't had time to look into every possibility, let's think about it. Milk plants, shellfish processing plants, hospices, everything was defined for the first time at some point, and it is difficult to imagine them knocking down the old plant down because they hadn't previously been required to get a license. The Attorney General's office has been backed into the legal equivalent of "because I say so." No one else has ever said so. It is certainly not anywhere in the code. We've read it, and we've gone backwards and done our research for precedents. It wasn't easy to find the original code and regulations, but we bothered to do what the Attorney General's office did not. And we've looked forward to the possibilities, the risks, the unintended consequences that the new abortion regulations create. They put all full-service hospitals, all healthcare facilities at risk. The Attorney General's office has said that provisions governing hospitals need to be made consistent with those governing abortion clinics. But don't worry, the spokesman continues, the changes are unlikely to affect existing hospitals. You know, because they exist. Once licensed, we really aren't that concerned. Herein lies another absurdity. Actual hospitals perform first trimester abortions too, but they are exempt from the abortion facility regulations because they were already licensed as hospitals. Even more absurd, hospitals are the only place second trimester abortions can be performed, a more invasive procedure, but they are exempt from abortion facility regulations. Unintended consequences, risks. Interestingly or mysteriously, given that the summary minutes of the June 15, 2012 meeting included Ms. Tissinger laying out the legal basis of the petition, that when the actual transcript notes from that meeting were requested under the Freedom of Information Act, they were unable to be located. But we have been able to obtain source material from the meeting to create a full transcript.
Thank you. Next speaker is Kate Bartelsnoon, and on deck is Whitney Whiting.
But we've been able to obtain source material from the meeting to recreate a full transcript. Ms. Tissinger says, quote, "Entities in operation that are now subject to licensure are all considered new facilities," end quote. Because they have not previously been licensed? They were considered physicians' offices. Think of your own practice, your peers. Are you confident that you don't meet the definition of hospital? The code broadly defines hospital as any facility which the primary function is the provision of diagnosis, treatment, and of medical and nursing services, surgical or non-surgical, for two or more non-related individuals. Section 32.1-123 from 2009. And it doesn't even matter. There isn't currently a definition of a plastic surgery center. But according to the Attorney General's office, all we have to do is name you, identify you, regulate you, and you are new. There is also a petition currently in front of you of the Virginia Department of Health to do just that, a petition for the Virginia Board of Health to promulgate regulations for the licensure of plastic surgery centers. The legal argument was easy to make. It pulls directly from the legal opinion that Ken Cuccinelli gave in 2010 when he was trying to give you the authority to regulate abortion clinics without legislative mandate. Ironic, first he tried to give you the authority, then he took it away. We don't want to limit access to any health care, but there also must be consistent, preferably rational, application of the law. Ken Cuccinelli has put me, us, the Board of Health, and all Virginians in an incredibly difficult position. Looking at the petition for amending the regulations for licensure of hospitals, it would be absurd to apply these construction guidelines, intended for new construction only, to facilities that have been safely practicing for years. Yet there is no rational explanation for why they would not be applied. I'm going to let someone else pick up.
Thank you. Next speaker is Whitney Whiting.
Yet there is no rational explanation for why they would not be applied. The VDH and the board must ask the Attorney General's office to explain how they can differentially apply the 2005 code. When the answer is that women's healthcare facilities are all new, since they had not previously been regulated for license as such by the state, then you should look for precedents and whether that argument has any validity. When it doesn't, and it doesn't, you must act on this hospital petition or take action to amend the new regulations for licensure of abortion clinics to appropriately grandfather them in as well. This petition is before you now. We are not asking that you support or oppose it. We are asking that you think about it, talk about it. Consider all the future ramifications of your actions, what precedents they set. And understand that there will shortly be a petition in front of you to amend the new abortion regulations to be consistent with the hospital regulations. And there are a lot of centers yet to be defined, regulations yet to be promulgated, centers to name into existence. Ken Cuccinelli wanted this so bad he has put healthcare facilities at risk. He has put healthcare in the Commonwealth at risk for all Virginians. Thank you.
Thank you.